Hi, most of us have heard the term rheumatoid arthritis. What is rheumatoid arthritis? It is nothing but an inflammatory arthritis. Inflammatory arthritis means pain and swelling of the joints. A lot of people think that it's a very rare disease, which is not correct. Rheumatoid arthritis actually affects around 1% of the population, meaning in our country there are more than 1 crore people affected with this chronic debilitating disease. People think usually arthritis is a disease of old age. This is the second biggest misconception. Arthritis can affect anybody, a child of 1 to 2 years of age to 80-year-old lady. So 1 to 80 years, anybody it can affect. It is usually more common. This kind of inflammatory arthritis are usually more common in females, with a proportion of 3:1. That means once 3 females are affected, 1 male will be affected. So it can affect males also. There is nobody is excluded. Anybody can be affected. So it's a common disease. It can affect anybody at any age. Although more common in females of reproductive age, or 20 to 30 years of females. What are the symptoms of rheumatoid arthritis? The symptoms of rheumatoid arthritis is nothing but pain and swelling of the joints. It can affect any joint, from the small joints of the hand to the wrist, to elbow, shoulders, knee, or ankle, or small joint of the feet. These joints will have pain and swelling. But what is the most characteristic symptom is, like any other inflammatory arthritis, these people will have early morning stiffness. What do you mean by early morning stiffness? When they get up in the morning, they are not able to fold the hands or bend the knees because there is swelling. After 10 to 15 minutes, slowly the pain will come down, slowly the stiffness will come down, and around 45 minutes later, it will become eased. If somebody has an early morning stiffness, that indicates that patient has a severe inflammatory arthritis and needs a proper checkup. But what happens most of the time? Most of the time, when somebody has a early morning stiffness or pain, we will go and take a painkiller from the nearby medical shop and we will ignore the symptom. By doing so, what will happen? The swelling and the pain we will think that the pain has come down, but actually pain and swelling is persisting. They are getting masked. Because the swelling is present in the joint, it will slowly, the inflammation will damage the cartilage and the joint will be destroyed. Why does this happen? Why does certain people get this rheumatoid arthritis? As we know, it is an autoimmune disease where immune system attacks the joints. Because the immune system attacks the joints, but because of certain factors. Some of it is genetic and some of it is in our environment. One of the modifiable factors, or one of the things we can change, is smoking, both active and passive, and having a healthy lifestyle. Most of the things are beyond our control. Why some people get and some people don't get, people are researching on it, but still we don't have a definite answer. But people think that there is definitely a genetic predisposition when compared to combined with the environmental risk factors, certain people get the disease. The problem is, most of us take NSAIDs and don't look at the basic cause of disease. What happens because of that? As I told you, first thing what happens is the joints get damaged. In the second step, the immune system starts, after attacking the joints, it starts attacking other organs. One of the most common organs is eye. Eye becomes dry and there can be redness of eye. Then it can affect other organs like lungs, heart, kidney, blood vessels, nerves, skin, all the other organs can be affected. Because of which the patient can have systemic involvement. And because of this, patient can even die. So rheumatoid arthritis, if not treated early, their joints will be definitely damaged. At a later stage, other organs can be affected, and this can lead on to death of the patient. The problem is that, the advantage is that over last 20 years, because of development in the field of rheumatology, there are very good treatment options available for rheumatoid arthritis. There are drugs which can control the immune system, modify the immune system in such a way that the immune system falls back on track. They are called disease modifying anti-rheumatoid drugs. They are not very expensive, they are quite cheap, With these drugs, rheumatoid arthritis can be controlled within 3 to 6 months in more than 85 to 90% of the patients. And with biologicals and newer medicines, 99% of the patients it can be controlled. But the sad part is that in our part of the country, there is a huge diagnostic delay, meaning there is a gap of 5 to 8 years before the right diagnosis is made. And after there are 1 to 2 years, the treatment is started. So around 8 to 10 years is lost when the patient gets correct treatment. By the time, joints will be damaged and other organs also can get affected. In today's world, if the disease modifying drugs are started as early as 6 months, more than 50% of the patients, disease can be completely cured, and disease can be controlled in 99% of the patients. So my appeal to all the patients, those who are having rheumatoid arthritis, is never get depressed. What should you do? You should consult a good rheumatologist and start the treatment as early as possible. If you are late, 5 years, 6 years disease, nothing to get depressed. After starting treatment, you will become better. Only thing is that because of certain damage must have happened in certain joints, you will require slightly intense physiotherapy and sometimes rarely surgery also. So if you have rheumatoid arthritis, definitely treatment is available, and only thing is you have to diagnose the disease early, start on correct treatment so that you can come back to normal life.